Number 1, the executive session in the first floor conference room. I'd like to call 1.01 for an executive session pursuant to ARS 38-431.03A8 for discussion or consideration of matters relating to school safety operations or school safety plans or programs. Board, do I have a motion?
I move that we move to executive session.
Second.
Thank you. It's been moved and seconded. I'll call for a vote. All those in favor? Aye. Any opposed? None, so it passes 4-0. We will remove for executive session, and then we will return to complete our meeting. And we anticipate that Dr. Santa Cruz will join us in the executive session. Thank you.
Those are for the...
These are for the...
Test 1 2 test.
Good evening and welcome to the board meeting for the Gilbert Governing Board. This is a work study session and a brief board business meeting. As is our protocol for work study sessions and brief board business meetings, you will note on the agenda that there is no open call to the public. That is typical and standard in this format. When we have a regularly scheduled business meeting, that item will again appear on the agenda. We will be working in a work study session, and we have 4 presentations this evening. Before we get started, Ms. Wilson, would you please call the roll?
Ms. Laurie Wood,
Here.
Mr. Reed Carr,
Here?
Ms. Sheila Ugeti. Here. Ms. Jill Humphreys. Here. Dr. Charles Santa Cruz.
Here.
Mr. President, all board members are present. You have a quorum.
Thank you, Mrs. Wilson. We will now move to item 3, item 3.01, which is the Arizona Department of Health benchmarks to reopen. And before I ask Dr. McCord for introductory remarks. We have just been involved in an executive session discussing items of school safety, among which the benchmarks related to this presentation this evening were discussed. And we are discussing not just the metrics for the county, but we are taking a look at whatever metrics we can discern for our local area and working those into our format and structure. The reason for that is to begin the process of a phased-in approach of opening schools sooner than later and getting that process in place. We expect that we will meet again, have a special meeting next week, and review some additional information provided to us by the superintendent and staff. And we have also given direction to the superintendent to take a look at that phased approach and present to the board at some point in our meeting. I'd like to defer just a little bit to Mr. Carr. He had some remarks he wanted to make, so at this point I will defer to Mr. Carr.
Thank you, Dr. Santa Cruz, and I'm going to echo some of what you just so well stated. As we begin this discussion, tonight, we want to be clear that we are looking to direct our superintendent and his staff to continue to look at the data daily. We know that that data is being updated, although it's not being updated on dashboards yet. It's being updated daily. So we ask him to continue to look at it daily on the county level that we have it, and to develop it to the extent possible on the district level. We know that we're waiting for elements for that to happen. It is our belief, based on the examination of some data, that things look much better in our district and in the East Valley than it may throughout the entire county. We are also anticipating, based on preliminary data available from the Department of Health, that the data is trending the right direction. So we invite him to look at that in a statistical means and anticipate where that data is heading, so that we can move towards the beginning of school in a safe, proper way as soon as possible. So our direction to Dr. McCord and his staff is to continue to monitor the data daily, to establish a plan to begin the start of school, which may include a phased start or other measures as they deem possible in order to ensure safety, and to prepare for the special meeting that Dr. Santa Cruz just mentioned on Tuesday, to present that to the board. We want to assure our community that we are united as a board. Our goal is to return to school as soon as possible. We recognize that there are many stakeholders that feel differently as to what safe looks like. We are trying diligently to balance those needs. We care about students. We care about our staff. We know that many want to be in the classroom now. We know that many are concerned about their health for various reasons. Dr. Santa Cruz, if I may add on a personal note, we know that sometimes as a board, we have to discuss things in an open environment in compliance with open meeting laws. That puts us at a real disadvantage compared to, at least in my profession, in business, we would never discuss some things in an open environment, and we would have prefaced and been able to discuss both one-on-one and amongst ourselves prior to a board meeting. Sometimes because of that environment, we respond and speak candidly in a way that is not necessarily perceived as kind, and that while we have a relationship and understand one another well, may appear to others inappropriately. I ask, this is a personal ask, I ask the members of our public to treat both me and my fellow board members with respect and kindness, even when you may disagree with us. None of us are here to be heroes or to be villains. We all ran with the right intent to try to do what's best for our community, even when members of our community disagree. So I would ask that even when you disagree, ask if you're doing so kindly and act appropriately. And I thank you for the opportunity to editorialize.
Thank you, Mr. Carr. And as I defer to Dr. McCord, all of the issues related to a reopening plan, as we look at the variables related to CDC guidelines, the Arizona Department of Health guidelines, and any of the guidelines that might be available to us and for public consumption out there be factored in to their reopening plan design, and that we ask members of our public and our community to understand that those guidelines are for their safety, their personal safety, the safety of the students, and safety of the faculty and staff involved. And while masks are a debatable item, they will, I'm sure, factor into the reopening plan in some big way. And so look at what is out and available and prepare yourselves for what may appear. We don't expect to be unreasonable. We don't expect to be onerous and heavy-handed. We simply want to make sure that we are adhering to the things that will make us safe and our environments safe for all who will attend. So with that, I will defer and turn it over to Dr. McCord.
Thank you, Dr. Santa Cruz, governing board members. I appreciate all of your comments, and we will definitely take your direction and come back with something that we think is pliable for our students and our staff next week. I think the most important word is safe, and we will design everything around that. We have been working on the background related to this, and hopefully we can come to you as a comprehensive as plan as possible. There still may be some details that will need to be worked out, but we will bring to you our very best effort up to that point. On another note, since I will freestyle just for a second here, a huge thank you to our students and our families and our staff for starting off the school year. We hit bumps. I sent out a letter last Friday, and I used that. I said we had positive comments, and we did get some positive comments, but we also had some very direct comments about some of the things that we ran into. Logging in on the very first day was a bottleneck. That was difficult. WebEx was difficult. We think we've mitigated a lot of those issues, and I know that there are still struggles out there for families. You didn't necessarily have children to teach them K through 12, and that's our job. And I applaud our staff, our teachers, our support staff, our principals, my team for running and doing the very best that they can given the situation. This is heading into my 26th year of education, and I got to tell you, well, even over the past 3 years since I've been superintendent, I don't think a lot of people have been met with the challenges that we've been met with as a board and administration and as a community. And Mr. Carr, what you talked about, about being cordial and kind is a very important aspect that we got to remember through all of this, because at the end of the day, this is about our children. Ms. Wood talks about that on a daily basis. All 5 of you do. And we got to do the very best we can for our students, whether it's online, whether it's in person. But I know that we can, and I know that we will. So I just wanted to make some acknowledgments there and make sure that people understood that where we're coming from as a school district. Thank you. So what I'd like to do now is talk to you. As you know, last week, the Arizona Department of Health, they came out with health benchmarks to return to school. And we were waiting for those, especially since our last governing board meeting, because a lot of school districts, including ours, have been waiting to see what we can do to make sure that we're safe when we go back, and what would those benchmarks be, and what would it look like, and where do we actually stand? And so I'll go through some of this, and board members jump in at any point in time, give any kind of clarification you'd like to give, because I know some of you have done some background work on this as well. The information I'm going to present to you tonight is based on county, Maricopa County, not town of Gilbert, not city of Mesa. This is just what's available right now in Maricopa County. And I think one of you mentioned it a few minutes ago that I think this week, probably Friday, Arizona Department of Health, along with Maricopa County, they'll be coming out with hopefully a dashboard that speaks specifically to boundaries of school districts. And so that'll give us more comprehensive information. If the decision is going to be left up to the school district, then I think it's important we have the appropriate information to make the decisions for our students that live within our boundaries. And so hopefully we'll be able to get that, and that's what we'll look at and talk about again next week when we meet. So just going to talk about the criteria, county trends, local data, assumptions for East Valley data, recommendations, next steps, and any questions you may have. But again, ask any questions you have along the way. I am going to read through some of this because it's pretty important as to what was issued by the Department of Health. ADHS recommends county-specific public health benchmarks to be in the moderate or minimal transmission category in all three benchmarks for 2 weeks in order to provide hybrid, virtual, and in-person learning. The ADHS Schools Toolkit defines community spread levels with the thresholds outlined below. Cases, a 2-week decline in the number of cases can be used to meet this benchmark, or 2 week of case rate of less than 100 cases per 1,000 population. Then you have percent positivity. For initial opening, 2 weeks of percent positivity less than 7% within the county, and COVID-like illnesses, 2 weeks with hospital visits due to COVID-like illness below 10%. And then this is what this looks like. Minimal spread evidence of isolated cases or limited community transmission, case investigations underway, no evidence of exposure in large communal settings. Moderate community spread, they define it as sustained transmission with high likelihood or confirmed exposure within communal settings and potential for rapid increase in cases. And then substantial community spread is large-scale controlled community transmissions, including communal settings, e.g. school workplaces. They further define community spread levels with the thresholds outlined below. These thresholds are consistent with the national standards set by the Coronavirus Task Force. And it just has those cases of percentages. For minimal, it's 5%, moderate, 5 to 10%, and of course substantial at 10% or above. Looking at this, in order to get to those areas, you look at, okay, what do we have to do when we're in one of those phases? So for no to minimal community spread, the delivery model would be a traditional setting. Face-to-face, in-person, here we go with school. Hand hygiene and respiratory etiquette, enhanced cleaning, proper ventilation, and monitor absenteeism. For the minimal to moderate hybrid model, you're looking at those I just spoke of with the inclusion of symptom screening, physical distancing up to 6 feet, cloth face coverings, cohorting, field trips and large gatherings canceled, communal spaces closed. And then, of course, substantial, you're just continue to be virtual until you hit those other areas.
Dr. McCord, I know we're going to talk a little bit about on-site support services, but if we could just highlight that that is causing a lot of confusion in the community as to why we're having some people on campus, some people not. That is something that's called for even when we're in a complete virtual community. Not only is ideal, but something that's being mandated through executive order. So for those who wonder why we are starting to offer that on the 17th when we're not offering full services, it's because it's a requirement of the executive order.
I appreciate you pointing that out. Thank you. Looking at the county trends, as of, now this is data, please know it lags probably by 2 weeks. So this is data as of 7/19. Okay, for the first category, declining cases are less than 100 per cases per 100,000 individuals for 2 consecutive weeks. For that benchmark, at that point in time, it says we have reached that. For the next benchmark, 2 consecutive weeks with percent positivity below 7%. According to this, the benchmark has not been met. But again, this is for July 19th. I think Mr. Carr has seen some more data that says it has decreased. If you want to touch on that a little bit.
Yes, again, pulling data from the Arizona Department of Health Services page, which was where this data, they caution us about going to current data because it's not a complete data set, it's the data lags. However, we can watch that to see where the trend is taking us and where it's going, knowing that while it's not complete data, it should be representative. So if we look at the subsequent weeks following that July 9th, knowing that the numbers may change, that July 19th, date of a number of 13.2% has since declined to 11.2% and subsequently to 8.7%. We would highlight that this week's data, the data as of starting Sunday 8/9, only has one data day of reporting in it, so it may or may not be representative, but we want you to know we're monitoring it with the idea of hoping that it is representative and hoping that it nears us to a decision consistent. But as of the one day of data that's available for this week, the positivity rate has declined to 4.5%. Our hope is that trend
And that's
holds.
as a county.
That's as a county, that's not local level, and as we indicated, we hope to look even more local. That is an indication that if that data trend holds through the week, that we would be very close to meeting this benchmark. And we'll hit this later in the analysis that you suggest. One of the things that we can all do is respond to the CDC's, the Arizona Department of Health, Maricopa County Health Department's call for widespread testing. As we have widespread testing, that does 2 things. One, it makes sure that the data is a larger data set and more representative of where we really are. 2, in the event that comes back with a positive, perhaps somebody is asymptomatic or pre-symptomatic, it identifies that you're positive early in the stage, allows you to quarantine and slow the spread, again, helping us to get back to school sooner than later. So I know you'll hit that point later, but we know that that's where the data is trending. We're monitoring it regularly. We like where it's going, and we hope that allows us to return to school sooner than later and invite your participation in making sure the data is accurate.
Thank you, Mr. Carr. The last benchmark is 2 consecutive weeks with hospital visits for COVID-like illnesses in the region below 10%. Again, pulling this, the benchmark has not been met, but if you'll notice, it has on July 19th, it met it, and it is trending down. So we expect to meet that benchmark.
And Dr. McCord, if I can add again, there is data available on the Department of Health subsequent to that, and it indicates, again, those numbers may change because the data is always changing in the last 2 weeks, but the week following that declines further to 6.4%, and the early data for the week ending 8/2 is at 3.9%. So all indications is that we've met that metric and we continue to meet that metric.
Thank you. And
Dr. McCord, can you remind us, can you remind us when do we expect to see the data updated by the state weekly? Was it every Thursday? Is that what you said is the projected date that the latest?
Yes, so this is from...
Oh, this is where it is.
Yeah,
okay.
on the right side is
Okay.
when they update it for what weeks.
Oh, perfect.
And
Well,
so I
you got
would
it outlined there. Thank you.
That's all right. It looks like a class schedule, I know. I think that I would imagine that it would come out the same if they do it for school districts specifically, but I don't know yet. Here we are, just some anecdotal type stuff. Arizona is currently 35th in the nation in tests done per 100,000 population via Johns Hopkins University. This is pulled, and here we are, just a graphic showing where we're at related to that. Local data. The health department has not made opening trend data available by school district or zip code at this point in time. You can get it for zip code, but you can't get it necessarily by the trend. Maricopa County has indicated, again, like we talked about, they'll be making data available at the local level. In our area, town of Gilbert, zip codes have 6 GPS boundary zip codes. Again, a third of our district is in the city of Mesa. We comprise 10 total zip codes. East Valley zip codes, Chandler, Mesa, Queen Creek, Gilbert, Tempe, AJ, Scottsdale is 49 zip codes. And GPS student resident zip codes, 89 largest zip code is 85234. Majority comes from 6 zip codes. Again, some local data is available, but it is daily case only, which meets criteria 1, which would speak to criteria 1. Looking at this next slide, this is just a picture of our school district, and the blue dots indicate different zip codes, and those are notated off on the left. And so just to give everybody an idea of where that's at, if you'll notice, you know, we have some larger zip codes in the middle, of course, like the 85234s, 85296s, but we also have pieces that go much farther within the Mesa area. And so when that data comes back, hopefully from Maricopa County related to specific school districts, they calculate or they use an algorithm of some sort to make sure that we are not encompassing all of those positivity cases in that area, and that it just isolates it to our boundaries. And that'll give us a more clear picture.
And sorry to ask again, so we think that that data, that we're hoping that that data that's more local to our district should be available this Friday?
That is correct.
Okay.
And then again, just zip codes, what I did was I pulled some of this information by zip code in certain areas. And again, just to caution you, those of you that are watching, those of you that are sitting there on the dais, for example, 85204 is primarily in Mesa, and this is a sliver of what's in our school district. But for the entire zip code, you know, they show 2,150 cases. And so I just lined those out and totaled them up. Again, these change all the time. And again, not all of them are represented of what our entire district looks like, because some of those numbers are a bit misleading in the fact that we take a portion of that zip code.
And Dr. McCord, I think it's also important to recognize that a couple of those zip codes that have larger numbers, I believe, include some long-term care facilities that would skew that data. And we highlight this so that the community knows we're looking at the data granular to make sure that we're looking at the data that affects us, and so that we can make a wise decision as we localize this data.
That is correct. Thank you for that.
And sorry, one more thing. Just also, those are cumulative cases. That's not just active as in the last 2 weeks. This
Right.
is since
This is
March?
since that we started counting them.
Okay, so I think that's something to remember too. Just because there was a case at some point
Right.
doesn't mean that it even has any effect now, except to say that those people might have antibodies,
Correct.
although we don't know for how long. So
Right.
thank you.
And just to follow up with that, Ms. Wood, I think also that doesn't reflect any contact tracing that may or may not have occurred with that aggregate number. We know that that's been lagging as well. So that 11,374 number needs to be taken very judiciously and very lightly in some respects.
Assumptions for the East Valley data. For criteria 1, Maricopa County is meeting East Valley likely would be the same based on, this is the same graphic that was on the other page. For criteria 2, which is positivity, percent positivity, East Valley testing is likely same or lower than Maricopa County, likely not meeting at this point in time, but again, the data is lagging. Criteria 3, hospital visits, Maricopa County is not meeting. East Valley is probably not different. They're likely not meeting, but again, trending down. Just to kind of reiterate, not just as a county, but also for East Valley. Just some data-related questions that have come up, and we'd like to point some of those out. The Town of Gilbert website says we have only had a 6% increase in the last 7 days. Isn't this less than 7% requirement? Well, this data is case occurrence data, criteria 1, which requires a 2-week decrease. 7% is criteria 2, which is percent positivity. Town of Gilbert is not reporting this data. Next one is the Maricopa County Health Department curve shows a downward trend. Doesn't this meet the requirement? Yes, this is criteria 1, which is currently being met at the county level. Department of Health website shows that serology percentage positivity at 5.6%. Doesn't this meet criteria 2? No, because criteria 2 is based on PCR, which is nasal swab or throat tests, which are at 14.1% positivity. The serology test measures antibody levels after you've had COVID. And then a local Fox News reports that GPS zip codes had 6,822 COVID cases with a population of 254,114 people. This is an infection rate of 2.68%. Doesn't this mean we are okay to open? This is criteria 1, case rate. We do meet this criteria, but the county does not meet criteria 2 and 3 at this point. Where is the official data coming from and how accurate is it? And this is the Arizona Department of Health Services, and let's see, well, I won't have to click on it. It's their website, their dashboard that you can get that. What is a data lag? Data seems to be taking about a week to be fully visible in the system. Arizona Department of Health Services is only using historical data with a 2-week lag. And as you guys saw, when those get reported, those are the 2 weeks.
Dr. McCord, can I insert here something here, though?
You bet.
I do want to say that we have noticed that the turnaround in testing data, it was taking a week to 2 weeks, and now the average seems to be 3 to 4 days. So we have a good metric there that will help in all of us being able to actually know if we have it or not and be able to address it appropriately, as well as that's something that will help, I think, with this data lag. If we have the accurate results within 3 to 4 days, I think that we should be able to start seeing more accuracy sooner.
Updated data in a more timely fashion. I agree. Does this data include hospitals and care facilities that doesn't represent our local area? Should this data be adjusted? We do have hospitals and care facilities in our local area, and they would be included. And so I don't know how you would adjust that, but they would be included in that number because, again, they're counting people. What is the importance of positivity rate, and why was 7% chosen? Higher positivity rates indicate an increased likelihood of community spread, and 7% is a rate that Arizona Department of Health Services felt was acceptable to start to reopen schools on a hybrid basis. Are there other metrics that support these or would be more valuable in considerations? Well, there's almost an infinite amount of data available. These seem to be ones that other states and districts are utilizing in order to determine whether schools should be open. Couple more. Should we be looking at demographic data, i.e., do children really contract the spread at the same rate? This should say there's a lot of conflicting data and reports on this topic without many actionable conclusions. I know some reports had come out recently, and again, I think part of this is that there's been so much information out there that people's heads are spinning when it comes to that. That's why even having the Arizona Department of Health or Maricopa County coming out with a set of parameters, benchmarks. I think it'll help us out in the long run. And what can we do to improve the metrics? Criterion 1 and 3 follow all the federal, state, and local guidelines. Criteria 2, that's the testing. Get tested. The more tests that there are, likelihood of the positivity rate going down if the trends continue to go. Also, some recommendations continue again to follow the local, state, and federal guidelines related to COVID. Actually, we're probably getting this, and that's request that Arizona Department of Health Services make the trend data available by zip code, and Maricopa County doing the same. Possibly using East Valley zip codes for decision making. Encourage people to get tested. Implement all of the other ADHS guidelines and monitor other states and school districts and learn from their experiences. And again, going back to what you directed me before is be ready with a phased-in approach that if we are able to come back sooner rather than later in a safe manner, that we're ready to go so our kids are back in class. And that's it for this moment. Any questions regarding that? Or anything that you want to add?
So Dr. McCord, assuming as we start to look not just at the historical data that we know is lagging, but also try to anticipate where that data is going in our decision making when we localize it. We know we're going to come back Tuesday in a special board meeting to look at exactly that. If the board agrees that the indicators show that we're moving towards the ability to safely return to school, how quickly could we return to class?
That's a good question, Mr. Carr. I'd like to say the next day, but that's not how it works. We also have to get a measurement of who we'll have in front of those children, how many are available for that. And so I would say it would at least take a week, but we would have more definitive information for you on that on Tuesday. Any other questions?
Board members, any other questions or comments?
Dr. Santa Cruz, if I may?
Go ahead.
If we could just keep in mind that we want to look for ways to meet the needs of our students and staff the very best way that we can, that we can find, using this data and using all the guidelines that we have available of how to keep classrooms safe as we get back to school, keep our teachers safe, and keep our students safe. That's our number, it's a huge concern, but also recognize that we need to find maybe creative ways. I appreciate the idea of maybe a phased-in approach as we get back to meet maybe some of those other guidelines, that we can really try and look for ways as the data is trending and allowing us to really meet the needs of our families as well as our staff. And I think we can do it, and I want our families and our staff to know that this is our goal, and that this is what we've done, and that this is what we want to do, and that educating our kids the best way that we can is what we're about, and that also we can do it in a way that, will meet the guidelines. It's going to look different, but we can still have that in-person opportunity as we proceed thoughtfully and using the guidelines and data that we have, and but keep moving in that direction. So thanks.
Ms. Wood.
Dr.
Board members, yes, Ms. Humphrey.
I just wanted to add, I think that looking at the metrics and looking at the data to make sure that we're doing this in a safe way, to make sure that when we open the schools, that hopefully we can continue and not have to close schools down because of a rise in cases. I think that's really important for our community. We want to continue the trust with our community that we're going to watch out for the best interests of students, staff, and the community in the way that we open our schools.
Ms. Giugetti, any commentary?
I just want to tag on to what everybody said. I think that all of us want to get back to school as soon as possible safely, and that we follow the metrics and what is safe for our community and our school district and so on. I think that we need to make sure that we communicate that we're doing the very best that we can, and that we're going to continue to do the very best that we can, and we will meet on a regular basis to make sure that what information we have is accurate. And I think you said it, Dr. McCord, that sometimes your head spins because there's so much information out there. But hopefully the Arizona Department of Health Services will give us some more data that we can actually use for Gilbert Public Schools. And we're hoping, I think you said this Thursday, that maybe they haven't done that before. They've just made it countywide. But if we can get some information that maybe can help us to know what we can do so that we can make sure that everybody is safe in our community, but that we also do the very best we can for our children's education. And I would also like to say that I know that I think this is an okay time for me to say this. One of the things that in many of the emails that we've received from parents that touches my heart in many ways is that, the frustrations that they have with their kids being upset and bored and all of them. Is there a way that we can get, since all of our schools have social workers at this point, and I'm not sure what the plan is, and maybe we're going to talk about it a little bit more on the online learning. Would it be better for me to wait for that?
It's up to you. Go ahead.
Okay. Just some way where we can have something so that if kids are really getting frustrated, that the schools can help out with some of the social and emotional with their social workers. Maybe, I'm not sure exactly what that would look like, but I think that is something that this year, because our parents supported us having the social workers in our schools, that would be a very important factor. So that maybe sometimes when parents are really frustrated, they would have somebody that they could get in touch with, or maybe some groups for some kids or whatever. But I really feel that's important too. Thank you.
I agree. Thank you.
Thank you, Ms. Uggetti. And just as a concluding remark, our commitment to faculty and staff, to the community and students, has been the safety of all concerned. And our direction has been focused on metrics and data that will help us provide the appropriate rationale for opening our schools. Once we have done all of that, then we will move as swiftly as we can in that direction. And that continues to be our commitment as a board to you, community, and staff. It continues to be the direction in which staff is going. They have not stopped working as it relates to trying to interpret the data, to provide information to the board, and to provide the direction that we might need to make appropriate and cogent decisions. So know that is our focus. Aside from an occasional notation someplace over the last couple of weeks in all of the emails we have received, I, speaking as one board member, and I think I speak on behalf of the board, the politics of all of this have not entered any of our conversations in the open or in private. And we are in communication with the superintendent individually as often as we need to be. So the center of this entire exercise is working to get young people back into the classroom. We know that teachers want to be in front of their students, and we understand the frustration that almost all of you are experiencing as it relates to the electronics and the online service. We hear you, we're working, but we're going to continue to put safety as our primary concern at this point. Dr. McCord, anything else?
No, sir.
Thank you. Board members, any other commentary? If not, then we'll move to item 3.02, fall sports schedules. Dr. McCord, I defer to you again.
Thank you, Dr. Santa Cruz. Governing board members, I have Mr. Steve McDowell, our district athletic director, Gilbert High grad, state champion, and all kinds of things. I'm trying to give you time, Steve, so you can pass all this out.
I'm getting old.
Okay.
Real slow.
He's going to talk to you about where the AIA is in terms of fall sports and how we'll try to be moving forward related to that.
All right, I'm assuming green light means I'm on. Before we get started, I want to thank you as a board for your contributions to our community. As Dr. McCord just said, I've lived in this community and been a part of Gilbert Public Schools for 40-something years now. As a student first, I'm not that old. I've worked with all of you and for many of you as well. So thanks for what you do for our community. Dr. Santa Cruz, Dr. McCord, I just gave you a schedule of what the AIA Executive Board has approved as far as a phased-in approach for fall sports. They are taking a phased-in approach, as we've already talked about as well tonight, for our school district. They're starting with some of the lower impact, lower risk sports like golf, as you can see that their plan is to start that on August 17th. Other outside sports, cross country and swim, will start on August 24th. Badminton and volleyball and fall soccer will start on August 31st. We don't have anybody participating in fall soccer. And then football will start with practice on September 7th. And their approach, their goal there is to, as many of you have discussed, to have a phased-in approach as far as that goes, starting with the lower risk sports and ending with some of the higher risk sports. As you know, we've been going most of the summer. We started back in May with our phased-in approach to return to activity. We were in level 1 for 3 weeks, and then we went into level 2 for us, which included throwing of balls and things like that, sharing of equipment. We followed all the CDC guidelines and all the guidelines we were given by the county and the state. And then we took a 3-week break when everything in the state started to climb, like a lot of districts around us, and then we started back up, and we've been going for 3 weeks again now. And so I can tell you through that time, our coaches and athletic directors have been diligent in following the protocol that Cabinet approved and that you approved to put before them. And we have had 3 coaches and 3 athletes during that time have tested positive. Luckily, 2 of those were during our 3-week break. I can say with confidence that those cases didn't arise because of our workouts, because we haven't had any more than 1 person in any given program at any given time who's been testing positive. So our coaches did take that to heart, and they knew that we were taking a risk, that you were putting trust in us, and they took that to heart. The picture on there, by the way, came from the AIA website. Paragraph 2 of what I gave you talks about modifications for fall sports that the AIA has also added. If you go to their website and look for those modifications, they actually have that picture, which is a workout taking place at Mesquite High School. So what we are doing in our district was used as an example to the rest of the state as what could be done. You can't see in the picture because it's really small on this. All those kids are wearing masks, so you can tell they're socially distanced, and they're working with their coach and with each other to improve their skills. So that's just one example of what's been going on for the last 9 weeks in our district. With this phased-in approach, we also feel, since a lot of our student athletes have been less active during this time than they would normally, that it's time for us to prepare them for the schedule to follow. And we hope in the future that we can start going on to level 3 as we prepare our athletes to get them physically ready for the demands that will be put on them as their sport starts up in the fall. Any questions about the schedule?
Thank you, Mr. McDowell. just before I open it up for questions, I would also like to ask you to convey our appreciation to the student athletes and the coaches involved in each of these fall sports for maintaining their level of diligence as it relates to all of the guidelines that you and your team set forth for them, and offer our appreciation for continued success as they follow those guidelines and through their season, as abridged as it might be.
Thanks, Dr. Santa Cruz. I will pass that on to them.
Thank you, sir. Board members, any questions?
And if I may, to address one issue that Ms. Shigetti brought up, we did have a lot of kids in our district that had the rug pulled out from under them last spring. And in the athletic department in our district, we believe in serving, the heart, mind, and body of our athletes. And we took that time to actually train our coaches in addressing social, emotional, and physical needs of our athletes. We did Zoom meetings with guest speakers, and we have coaches and athletic directors who've been diligent this whole time, keeping in touch with their athletes, giving them an emotional support, and contributing to their overall well-being. Because obviously what happens in the mind and the heart is going to affect what happens to them physically. And all three of those need to be addressed. And so that is a movement that started in our district 3 or 4 years ago, and it's one that we will continue to grow and develop.
Thank you for that. As you know, I know for so many of those kids, sports is their outlet and their life. And so I'm really glad. And, I think being a sports fan myself, it's been hard not to even be able to watch games and deal with that kind of thing. So I think I really appreciate that you're doing that for the kids.
Well, and that originated from our coaches and ADs. They just wanted ways to help, so we got them the resources to do that.
Thank you, sir. Ms. Humphries?
Yes, I did want to thank you and everyone for the hard work that's been put into this. I think this is really important, and I appreciate that they're being careful, but trying to provide those opportunities to students. I mean, a lot of students, this might make a difference for a scholarship or something. Could you just remind us what it means when we go to level 3, because some people may not be aware of that?
Thank you. Yes, level 3 would be still following social distancing guidelines as far as the number of participants in any given field or any given gymnasium. Level 1 was just physical workout. Level 2 added sharing of equipment like a ball. Level 3 actually involves more hands-on, more one-on-one type drills. And then level 4 would be opened up to full scale, whatever the sport. So when we go to level 3, that will actually add closer contact for our student athletes to be in closer proximity to each other. We have districts around us who have been in their level 3, what we would call level 3, for 10 days now. And this whole situation has opened up lines of communication among all of us district ADs and ADs across the state. We all communicate on what's going on in our districts, and those districts who have already opened up and gone to level 3 haven't seen any adverse effects yet.
That's good to know. Thank you.
They continue to monitor that.
Thank you.
We also use data from other states. I know Texas, they're like 3 weeks ahead of us. They've already started their football. In their 8 weeks of summer open workouts, that was actually regulated by their state. They had 66,000 kids involved in football. They only had 4 kids test positive during that time. So it's definitely being closely monitored around the state, obviously, and across the nation.
Thank you, Mr. McDowell. Mr. Carr, I know at our last board meeting you had some concerns related to athletics. Have we addressed those concerns?
Yes, this was met. I think the questions were, how are we moving forward, and this addresses that. I think related to that, we also talked about some of the other activities that aren't necessarily sports, extracurricular activities that don't necessarily fall under the AIA that would, our band competitions, our performing arts, et cetera. And I know there's some people here asking that. Meets my need, but I do have to ask the question. Esports Is it dangerous, and that's why it's being pushed out to the last start of September 15th, or?
I guess so. I just don't like they put sports behind that. I don't know. It seems like my whole life we've been trying to get kids off the couch, and now they're calling sitting on the couch playing a game esports. So, but it's definitely growing, and that is one season that wasn't affected last spring. So those kids still are, and that is a game. It's a team sport. It's not just individuals. So there are definitely a lot of positives that come from that.
Mr. McDowell, just to ask the question on those other extracurricular activities, your fine arts and so on, they also have competitions that are outside of AIA, and perhaps someone else needs to answer this question, or we can get that. Are those, the ABOTAs and so on, are they moving forward with their plans with the performing arts? Do we know on that as well? They have moved forward. We do apply our phased-in approach or level approach was applied to all activities, not just athletics. The cabinet's done a great job in our district of communicating that. So the band kids, the ROTC kids, all those kids are basically following the same phased-in plan. Last I heard, I don't know if it's changed, but last I heard, the ABOTA had decided to cancel their band competitions. We do have another organization that runs those in the state that at least one of our schools belongs to. As far as I know, they're still moving forward with their competition. I don't know if they canceled or not. But they did decide to cancel band competitions, but they are still going to have marching band. They are still going to support the sports and move forward as far as that goes.
Might take a bit of the stadium to spread out the band kids far enough apart.
Yeah. we hope that's a problem we have to tackle.
Okay.
Ms. Wood, any questions, comments, concerns?
Just thank you, and again, just a reminder that this is in place. We'll follow it. We'll follow the guidelines the best we can. We will follow the guidelines, and then we're hoping that this sticks, but there'll probably be changes that come up. But we'll adjust and we'll do the best that we can, and we'll keep the students in mind to make sure that we do the best we can for our students.
As I talk to the executive director of the AIA, David Hines, every time I talk to him, he'll say, well, as of 10/15 on, and give the date, this is the plan. So yes, it has been very fluid, and change has been the one constant thing this far, but it's great to have the dates. There are areas of the state that don't think they can follow this plan, but gratefully the AIA has decided to move forward and not wait for everybody, but for the majority who can follow the guidelines and return to activity. They're deciding to go ahead and move forward, and then they'll make accommodations for those other schools that can't participate at this time. They'll make those accommodations as the year moves on.
Steve, do you think there'll be any repercussions at all from the major colleges conferences today that are get canceled? I mean, in Pac-12 and the Big Ten.
They seem to be when the SEC falls, then we know something really serious is going to happen. I think they'll be the last if anybody does. I know those presidents and those athletic directors have a lot more things to consider than we do at the high school level. Interstate travel, for one. A lot of states have bans on kids traveling from across state lines and being quarantined and everything else. And so luckily, here in this state, we did have some teams who were going to travel out of state, but those games have all been canceled. So we know that we don't have to worry about interstate travel. There's a lot of finances in those decisions at that level that we don't have to consider as well. And so does it make us nervous? Absolutely. Is it going to have a direct impact? I don't think as direct as some might think. Like I said, when we have other states around us who are weeks ahead of us, Texas was another hot spot when we were hot in Arizona. And when they plow ahead and move forward and we find that they're able to participate without their numbers spiking, then it gives us a lot more hope.
Thank you, Mr. McDowell. Mr. Carr, something else?
I just wanted to, I meant to do this when it was my turn, but want to express my gratitude to Mr. McDowell and to all of our coaches. I think if our community may not realize that back in, I think it was early June, we discussed this plan and approved it. And at the time, it was before AIA had a plan. In fact, they borrowed things from our plan. So in terms of keeping these activities going, the extracurricular activities as a whole going, our district has been at the front of keeping those activities going. Sometimes we fail to recognize that, so we authorize that. And so I thank everybody at all of the schools involved with athletics and Mr. McDowell for your leadership, because we have been in front of the state on these things.
Well, thank you for that, but once again, I think that goes back to you as a board and to our cabinet. You know, the GPS cabinet's been very supportive of us, and we all recognize that you're the ones that have your neck stuck out in this situation as far as that goes. So thank you for that compliment, but I think that really should be reflected back on all of you. You're the ones that are in the line of fire for making those kind of decisions. So thank you for your trust in us and for allowing us to continue to move forward.
Thank you, Mr. McDowell. Board members, anything else? If not, then we'll let Mr. McDowell loose here for a little bit.
I'll mask up.
And we'll move to item 3.03, on-site support learning plan. Dr. McCord.
Thank you, Dr. Santa Cruz, governing board members. I'll bring up Jared Ryan, wherever he's at. He's right there. And I want to reiterate that, and I think one of you said it earlier, I believe it was item 3 of the most recent executive order. A lot of people are asking, why are you doing this? Why is this happening? And please know that I understand your concern, and but we're trying to follow the rules, the executive order, and I'll just read this one more time. It says, each school district and charter school shall begin offering free on-site learning opportunities and support services for students who need a place to go during the day as required by Executive Order 2020-41, and shall begin August 17th. And then it has a list of other areas down below. But this is where this stems from. Mr. Ryan and his team and our folks have been working in cooperation to make sure that we get this set up and ready to go. And I'll turn it over to him so he can explain what that looks like.
Thank you, Dr. McCord. President Santa Cruz, Governing Board, really appreciate the opportunity to be able to present to you this evening a plan that has been in the works quickly. It came together for us, but stemmed from a number of conversations that the entire group, cabinet, teachers, principals, parents, have been involved with, a number of detailed conversations to make this come together. Coach McDowell just finished up presenting, and you have nobody better than Coach McDowell leading the way in terms of athletics. Coaches who respect his word and the things and his guidance and the direction, and he's had a tremendous amount of success. Our programs have because of that. Our hope is to emulate much of what he has done in building confidence within our community and support for our students by rolling out an on-site learning support plan that both meets Governor Ducey's executive order, as well as taking advantage of the opportunity to serve our population of students that are most in need. There are a number of groups that fall underneath that categorization, but we view this as an opportunity for us to be able to do some great work with our kids, but also while trying to ensure that all the safety and mitigation strategies that have served us so far throughout the summer continue, and we learn and we get better moving forward. As Dr. McCord stated, this is part of Executive Order 2020-51. Mr. Reed, I appreciate the words earlier outlining the fact that it does seem fairly strange for us to welcome some students onto the campuses when we're saying that we're not open for online or for in-person instruction, and that has certainly led to some confusion. I've received a number of emails, phone calls, whatnot, asking for clarification regarding that, and so hopefully at this point in time, it's widely known that we're meeting the details of that executive order. We had a few things to consider as we were planning this. We know some of our surrounding districts, and we know some campuses that are opening up large areas within a campus and bringing in a number of students without much structure, much detail to that plan. We also know some others that are putting a lot of thought and work behind it, and we wanted to go that route. We feel as though our parents, our students deserve the best that we have to offer. That being said, there is a reality of the number of staff members that we have to serve our families in this capacity. Our staff members, our certified staff members right now are assigned to students online, and they're serving them day in, day out and planning for them when they're not in front of them online and virtually. This has us turning to our paraprofessionals and sports staff members, as well as coordinators of various departments and instructional leads and other support staff members throughout the district. OTM has been very helpful for us. Principals have been absolutely outstanding to identify members of each staff that are able to assist in this. There is a portion of the executive order which allows for us to look at staffing and look at campus safety and mitigation plans and determine numbers. And in this case, we're opening our campus to 90 students, each of our campuses, for service in the areas as outlined through this plan. These groups are divided into two categories. We have our open lab students. These would be students that qualify based on a specific bullet point within the executive order that talks about young children receiving supervision for parents who are working or students that are in need for a variety of reasons. Qualifying services is our second category. The qualifying services would be special education, ELL, gifted, McKinney-Vento, free and reduced lunch, different categories which a student may qualify. And there is actually a third component, which is specially designed instruction, SDI, and those students are being contacted personally by Fran and her department, as well as some others who have students who cannot receive their requirements of their instruction in an online format. There are some specific examples to this, and typically that's a team or on-campus decision based on IEP and other design plans that have been put in place prior to this. Elementary campuses will be open to our on-campus open lab time from 8 o'clock until 3 o'clock. Registration is actually open right now until 10 p.m. on Wednesday, so tomorrow night. Communication has gone out through Dawn and her team to every parent within our community, as well as specialized service instruction information going out to those specified groups that we've categorized that qualify for a variety of different reasons. So once again, elementary campuses, 8 until 3 o'clock for that on-site open lab. The bullet point that talks about young children, we've discussed that and believe that really refers to our elementary population, which is why you'll notice the open lab setting is only available on our elementary campuses. Junior and senior high school or secondary schools all have specialized service or qualification area availability for students to go in and be able to work with support staff members that are assigned to those areas. Some questions have come up related to the specialized areas and qualification areas and what that means in terms of individual support. And to be honest, it really depends on one, staff availability, two, scheduling in some cases, and once again, the ELL group, the special education group, and everyone within those qualification areas are creating schedules for whether it be in-person, pull-out, but those are set periods of time. That is not an 8 a.m. to 3 p.m. service that is being provided, but rather set periods of time where staff can go in and work with those specific students. Any questions related to the differences between what is offered on our elementary campuses and our junior and senior high campuses, or specifics related to the learning, the on-site specialized support in general?
Dr. Santa Cruz, if I may ask a question.
Ms. Wood.
Thanks. I appreciate that we are meeting the letter of the law as far as the executive order. I'm concerned that we're not meeting the needs of these students who are coming to us because their parents are both working. I know we're in a hard place, but I'm just trying to figure out, is there anything better we can do for these students, or how do we better meet their needs if they're going to be there from 8 to 3 and they're trying to basically take care of themselves the best that they can. And I know we're limited on staff because of all the other things that we have, but just, I guess, wanted your thoughts on that.
Sure. Obviously, something we're concerned about, something we've put an abundance of time into discussing and trying to organize. I've had an opportunity to speak with a few parents. There are pieces that we have in place in terms of our plan of action that are minimum standards. If we can have, we were even talking with our elementary principals earlier today, this is our baseline. Based on the number of staff members we can have in a room, the trainings that we're putting in place, OTM, technology services, a variety of others have come together and compiled trainings for paraprofessionals and support staff members who this is going to be a task that they haven't been asked to do prior. This will be new for them. So to have a support staff member of a different category even potentially, you may have transportation assistants or transportation aides now in a classroom working with students. It's going to take training, it's going to take work to make sure they're prepared to be with our students. We're following mitigation strategies, which we created over the summer, where reduced numbers within a classroom, more adults per student. So we're optimistic that as this rolls out, we're going to begin to find opportunities for us to work more individually with students, get more creative with the things that are going on within the day. That being said, the actual letter of the law and the intent of the plan as laid out was certainly to give a safe place for our students to be, and we know we're going to be able to provide that. And so step one is ensuring a safe place for our students to be who need that from a variety of categories and with a variety of needs. And from there, I believe we're going to be able to grow and develop depending on the length of time this continues. And that is certainly our plan. That being said, I can't guarantee something right now, and I certainly don't want to put something in front of the community that makes them believe something is going to happen that may not be there on day one, Monday, given the timeline we had to create this opportunity for our families.
Thank you.
And you might not be able to answer this question, it might have to be Fran, but how are we going to work with some of our children that have some more emotional needs, if they have meltdowns and things like that? What do we have in place for that?
So there is.
Sorry to put you on the spot.
I can share.
Okay.
Fran, come on. I can share also from Susie Cadena with our social emotional learning has a very strategic plan outlined utilizing social workers such as you mentioned prior, and with identifying students, targeted students, groups, outreach, in person, and a variety of other pieces that she is working with her social workers on making sure are in place as well. And so just to speak to the piece that you mentioned earlier regarding social workers and their support.
But with all due respect, they don't have the training necessarily to work with some of these children.
No, these are two separate pieces,
Right.
certainly.
Right. So on the other side of the services that we will be providing as required by the Department of Education will be in-person, specially designed instruction and services that teams have determined students may be struggling or not able to receive completely or to a proper extent online. So if we have students who have some IEP goals, for example, and social emotional needs, and we're not being able to address those needs in an online format, that might be a student that a team would determine may benefit from some time to come in for some appointments during that in-person, specially designed instruction time and receive those supports.
So basically, not every special ed student will be brought in, correct?
Correct.
Okay.
For the in-person, specially designed instruction and services component, that will be determined by teams based on students and how they're doing with online, and it's primarily for those students who have more complex needs who aren't able. And one example would be a student who has on their IEP to learn Braille. that's hard to do over WebEx, but we could bring them in and work with them in person. Or maybe a student who has physical therapy. It's hard to do that over WebEx, but we may be able to do that and provide that IEP service. It's for those IEP services that we need to provide them with that the in-person is being developed to meet.
What about like students with autism? How are you?
I certainly expect there will be teams that will find some of those students who are not benefiting from online, maybe those students that will be recommended to come in for some in-person specially designed instruction. One of the ways this differs from what Mr. Ryan is developing is that in this in-person component, it will be either a special education teacher providing specialized instruction or a therapist that's providing it. There may be a para supporting, but it's not primarily a paraprofessional.
And would those numbers possibly be kept, the class size is smaller? Or maybe even just one-on-one is what I'm hearing you say?
To follow the CDC guidelines, we've asked that teams not have more than 6 students in a classroom, and then the teacher, the para, and we know there may be therapists wanting to come in and out to also embed some of their service time within that time.
But I'm sorry. If some of the kids are high needs, you could keep it less than the 6?
Absolutely,
Okay, thank you.
absolutely.
Sorry. My question is, will some of these students just come in for like an appointment time only, for that exact service, or will they be there, most of the school day? Or is there a variety?
We've been advised that this type of support is more of it's on an
Okay.
appointment basis. So what it might look like for a student is they may start their day online, they might come to the district to receive this, or to their campus to receive that in-person support for an hour or two, go back home, and then get back online and finish their day
Okay.
online. So it's not taking the place of that online instruction that we're providing now. It's to ensure that they're receiving the benefit they need from the instruction that we're providing.
Okay, thank you.
Go ahead, Mr. Ryan, continue.
Another portion, this piece was outlined by the Arizona Department of Education, was guidance related to registration and the ability to provide campuses with a registration list of students for them to properly identify ways of servicing them. And so community education became involved with the registration process to ensure we're able to supply each of the campuses with rosters. That way principals, and actually we have campus facilitators at each location to help monitor and guide this in the implementation on each campus. Today, we trained over 100 people from campuses across our district on the registration process and how to pull those rosters. Earlier, we talked about grouping of students and cohorting of students, and whether we identify gifted as a need or ELL as a need or special education or groupings in a variety of ways, we'll be able to identify those students in advance and prepare for their arrival on Monday morning. We have push-out services and extension activities for our gifted students. We have ELL service providers rotating throughout the district as well assigned to campuses. We have a variety of specialists and coaches that are going to be on campuses. So the scheduling has certainly become complex and one that is going to be successful, but certainly we needed time. And so we've received questions related to timeline of registration and why that exists, as well as the 2-week re-register window. The reason that exists is because Kathy Hoffman has provided guidance that said registration every 1 to 2 weeks, and so we pushed it out 2 weeks just to build a little consistency for that 2-week period of time, and then the window reopens for new families to enroll if they should choose.
Mr. Ryan, you just said that, you'd be having some therapists, and Mrs. Grossenbacher said the same thing too. The people that'll be coming in and helping do these things, will they be also required to be teaching online too?
So the individuals that will be working with us are not also instructing online or have part-time schedules online and then are free a portion of their day to then be assigned throughout the district to help support campuses.
And would that
I
be the
can't
same
speak
with the
to-
special education students too? Or special education teachers, I'm sorry.
Just stay there.
Get your steps in today.
For the in-person supports, those will be the teachers or providers for those students because they know those students and know what their needs are. So they will be providing, they'll be continuing their online service or instruction, and then they'll be including the students that are in the small group in person into what they're doing online.
So they won't be given quite as much of a caseload in terms of online, so that they'll have the time to do both?
We don't know exactly yet. I can't answer that because we don't know exactly who they're going to
It's gonna
find
work,
eligible
okay.
yet to know how that will all sift out.
But we'll make sure that they don't get on overload, right?
We will be working with them and we're giving them some strategies and ideas on how to make this work and fit into the schedule of their online
Okay,
instruction.
thank you.
Mr. Ryan, correct me if I misspeak, but the services that are being provided in what you're outlining this evening are a part of the governor's executive order. And in collaboration with Superintendent Hoffman, these services in some cases could have been provided by partner organizations like Boys and Girls Club, YMCA. We just happen to have in community ed the service capability, and so we've extended ourselves as a district. Is that an accurate statement?
Absolutely. We, early on when this was presented or outlined in the executive order, we awaited clarification. If you remember when the executive order was initially released, the details within the on-site learning weren't clear. We waited for the ADE to supply further guidance, and a piece of that was related to you may or may not provide on all of your campuses, you may or may not provide on your campuses at all, but if you don't, then partner with a local agency. And as we met, and Dr. McCord was very, very clear that we support our community and we support our families. And so we've gone to task with the fact that we want to provide a great product, understanding the limitations that might be standing in front of us, and so that's where we are today.
Thank you for that. I just wanted to make sure that that was clear to our community because we've stepped up, essentially.
Absolutely. As I mentioned prior, the social emotional learning supports will focus on providing SEL activities on SEL competencies within the BUZZ platform with additional supplemental support from SEL programs. Students will receive tiered on-site in-person support based on individual need as determined from SEL screeners, social work referral forms, behavioral assessments, and threat assessments. This may include individual support, small group facilitation, and/or family outreach. Susie Cadane has done an outstanding job putting together a plan for us to be able to support our community, as difficult as that is when we're not together every day. And I wanted to be able to share the plan she had in place. This moves us forward on parent screenings and of their children, as well as adult screenings and staff screenings. This moves us into what it would look like to return in person with these screenings and tools being provided to our families as they screen their students each day prior to attendance. We do have sign-in and sign-out procedures in place on each of our campuses. We're actually utilizing a portion of our VIK staff to assist our campuses, and VIK is opening on August 17th as well for before and after school care for our families, and we have authorized VIK staff to remain on campus into the school day for a period of time and arrive early toward the end of the school day to assist with the processes of both students registering when they come in, or signing in as they come in. It's something that our staff is very used to, that we're working with our on-campus staff to kind of take a grasp on. And we also have 9 sites that are currently open, as you're aware, that began last week over a 2-week period of time. Today we received some great feedback from the site principals related to drop-off and pick-up strategies for mitigation and limiting the number of people on campus and coming in and outdoors throughout the school day while maintaining safety. So you'll notice parent expectations, student expectations, and then the safety measures that follow. Referred to the 90 students within approximately 6 to 8 classrooms. Within our world, we like definitives. We like black and white. We like to know what is in front of us, and this is a challenge. We don't know yet what registration numbers are going to look like on every campus. We don't know yet what the needs of each student is going to be who registers on each of our campuses. We're not clear as to how many staff members we have available, although we're dialing in on that right now, and hopefully by midday tomorrow we'll have that ironed out. But there are a number of pieces that are moving, and so I apologize if some of the responses that Fran and I give you aren't as detailed as you may like, but it is a moving target at this point.
Well, I do appreciate how quickly you've had to put this together. I mean, honestly, we would have usually taken 6 months to a year to plan something like this, and you're doing it in just a few weeks. So thank you very much for all the hard work.
Absolutely.
Mr. Ryan, I know that
Yes, ma'am.
you've utilized the safety measures throughout your summer VIK program. And I think that what you have recommended here is really good in terms of everything. And I think that really one of the good things that will kind of go along with what Mr. Carr said at the very beginning of the meeting, this is going to help us too. The information that we get over the next few weeks will help us see how the safety goes. And I think you were successful this summer, so let's keep it up.
Thank you. Honestly, Kristen Stoltzman, Eric Dactyl, the specialists, it's been I would be absolutely lying if I didn't tell you it's been a challenge. But I believe the way we were able to start the summer in terms of learning, smaller numbers of students, variety of campuses. If you remember, we were on each of the high school campuses and learning. This is the next step. The last 2 weeks have been another step. Coming up August 17th is an additional move toward opening to more students, and I think that it's been a positive thing for our students and our families. So we'll continue to learn and get better as we go.
And just so you know, when we get to the phased-in approach and we have students who are now face-to-face, this, I believe, would still be in effect for those that are online as well. So we would still have to continue with this portion of it for those students that need support.
Mr. Ryan, if I can just comment, first of all, thank you to you and your team for all of the work. As was indicated by Ms. Humphreys, we realize that you're putting together a program very, very quickly in response to an executive order. I think you've done a very good, high-quality job. I fear it's going to be underappreciated because people are going to be looking at what they want and are used to from previous years versus what we're doing in a very short time period. That shouldn't take away from the quality and the appreciation. I commend you for your services, and I have to say, I hope that the program is very short-lived because we're back in person and providing full services, and that's not an indication of underappreciation for what you're doing.
We appreciate that, and obviously the support and trust from and Cabinet's work on this and advisement every morning as we put this together. So Jason Martin and Marcy and Barbara and John and the whole group, Dawn and her communication has been a lifesaver, and as we continue forward, it'll keep growing. So thank you.
Dr. McCord, to your comment that this program format will remain in place even as we phase open and start in-person learning at whatever point that becomes available, that will extend through the duration of the executive order. Is that correct?
Yes, sir, that's my understanding.
And so the expiration date for that executive order in most cases is at the end of the school year.
That is correct.
Dr. Santa Cruz, could I ask?
Yes.
So I just had a couple questions about the safety. Are we able to and planning to give our paraprofessionals and other support staff that will be there a mask and or a shield similar to what we have secured for teachers?
Absolutely. So their option, Bonnie has been fantastic at getting product out to campuses and working with operations on both sets of supplies, whether it be PPE for the individual employees or whether it be cleaning and sanitation products for the campus. From the trainings that have been put together and our staff today, I received a couple of questions related to trainings. Friday is going to be a big day of training a number of employees, and Jen Frost and her team have put together an excellent video. Jack Barnes, Fran and her crew, and so the number of people coming together between documentation, online links and resources, Leanne Lacey, is all coming together. That's being packaged. Dylan has access to that to share it with each of the facilitators on every campus. We want individuals feeling comfortable walking in on Monday morning, regardless of what their assignment and task may be, that they feel trained and prepared and safe and supplied the necessities to be successful.
And then what's the process that if someone does have COVID, if they are diagnosed with it, either a staff or students, what is the process in place? Probably similar to what you've done this summer?
Sure, absolutely. So Nurse Frost has created a series of letters depending on the scenario. If a student potentially was exposed by a staff member who is test positive, everyone within that location obviously is notified. The person who has been tested or the person who's symptomatic is removed from that location and is quarantined based on their positivity or their symptomatic responses and what may be going on. We also report to the county any cases for tracing and to make sure that we are identifying if there is a pocket within our community where we're seeing things. Albert and his operations crew comes in and takes care of the location where that staff member or student may have been. Those students are then, if it's a staff member, let's say, those students are then placed in a different environment for the next period of time while we ensure that the classroom is taken care of and cleaned properly. And as I said, everyone is notified through the letters that is a potential, and then they're given the option if they want to return or not, that family decision at that point in time.
Okay, thanks. And I think, like you're saying, we've had these things in place during the summer and had great success. And then here we are now doing it again. I think we have some patterns of successful having students at our schools. You know, it's been small, but we're growing it back. And I think that we can learn from what we've been doing, take confidence in the measures that we're having in place, and continue to hopefully have ideas and things ready to implement as we get to that point where we can get back to school with everybody.
Sure. Our, just so you know as well, our promise to the community has been to, if anything, over-communicate. That hasn't been the stance of all school districts, and we have felt strongly about ensuring that parents, staff, students, anyone who may be impacted or affected in any way is communicated with and notified of any potential scenario, whether that staff member is in your exact class or just within a facility. And we feel as though that's important, and the responses have been very positive in terms of just gratefulness that they feel comfortable knowing that they would be made aware if there were any cases on campus.
Board members, any additional comments, questions? Mr. Ryan, you've been very thorough, and again, on behalf of the board, we extend our appreciation for your work, the work of your team, and the collaboration of all of those concerned. We wish you good luck on Monday as we go through, and we hope that you will experience the same degree of success you've experienced during the summer. So appreciation to you and your team.
Thank you, sir. Appreciate that.
Thank you, Mr. Ryan. Thank you, Fran.
We now move to item 3.04, face covering policy regulations, GB-R, JICA-RB, and KI-RB. Dr. McCord.
Thank you, Dr. Santa Cruz. Governing board members, per executive order, item number 5, and I'll read this to you as well. Says all school districts and charter schools shall develop and implement a policy to require face coverings, or such as face masks or face shields, for all staff students over the age of 5 until Arizona Department of Health Services determines that face coverings are no longer necessary or recommended to contain the spread of the virus. And so that's what we have done in consultation with ASBA and Udall-Shumway. They've developed a policy that is very standard, and we will be covering that in the regulations contained in those 3 policies. GB-R, staff's personal security and safety, and then JICA-RB, student dress, as well as KI-RB, visitors to schools. And let me read through this for you, if you'll indulge me a little bit. All persons, including but not limited to staff, students, vendors, visitors, and volunteers, shall wear a face covering while on any district property, in any district facility, at any district event, whether indoors or outdoors, and in any district vehicle, including district buses or vehicles rented or leased by the district. Face coverings should not be worn by A, children under the age of 2, B, anyone who has trouble breathing, C, anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Students under the age of 5 are not required to wear face coverings. Students shall not be required to wear face coverings when students can socially distance or are outside in playground settings with distancing. Students shall be allowed breaks to remove their face covering in a safe environment. The superintendent may make other exceptions to the requirement to wear a face covering while keeping in mind the health and safety of everyone involved. Face shields may be an acceptable alternative to face coverings. Face coverings are to fully cover a person's nose and mouth, ideally fitting snugly but comfortably against the sides of the face and under the chin. They are to remain affixed in place without the use of one's hands and are to not have holes. They are to be laundered regularly or disposed of appropriately. A face covering does not replace the need for frequent hand washing, covering coughs and sneezes, and practicing physical distancing 6 feet away to the extent possible. Individuals are to be reminded to avoid touching their face coverings and to wash their hands frequently. To ensure the proper use of face coverings, staff and students are to be educated on how to wear and care for their face coverings. And again, legal reference, Governor Ducey's 2020-51. This is the exact same language in all 3 documents. I just wanted to make sure you were aware of that. And because of regulations, they don't need approval by the governing board, but I wanted to make sure that you knew where we were at, and this is what we'll be implementing moving forward. Any questions?
Thank you, Dr. McCord. Questions, board members?
I do have a question. When we're talking about giving students a break in a safe environment to remove their mask for, a couple minutes, give them a break, what would that look like? Maybe in one of those classrooms where maybe students will be coming on the 17th.
If you have an area available to where you can social distance students so they can take them off, then we would instruct the paraprofessional or teacher to be able to do that. And I think that they would be able to, as professionals, make sure that they have those available areas and can read the room in terms of, okay, I think you guys need a break.
Okay.
And you need to have a little breath when it relates to that.
Okay, all right, thank you.
This is something that we believe is very important. We believe that moving forward, in order to get our kids into campuses, to make sure our students are safe, to make sure our staff is safe, we need to have something like this, and we will make sure to the very best of our ability that our staff and our students are following this.
Board members, nothing else? Move to item 4, which is adjourning this work-study session. If there are no additional comments, then I will...
Could I make a comment real quick?
Go ahead.
I just wanted to thank those who have emailed, which we've mentioned, we've read many emails, those who are here at our meeting tonight, or some have left, but I appreciate that they came, those who are watching our meeting, just for along with our teachers and staff, just want to thank our families and parents and students, that they want to be part of our schools, that they want to be back at school. When have we ever heard high school students asking us to please let them back in their school? I mean, that's a great thing about our teachers, and our campuses should know that means we are doing a great job because our kids want to come back. And also, just know that we're going to keep working toward finding solutions that meet the needs of students and staff and both safety and in their social and emotional needs. But just want to thank our community members and acknowledge all that they're doing, and our teachers and staff as well. Thank you.
Thank you, Mrs. Woods.
Dr. Santa Cruz,
Go ahead, Ms. Ujetti.
I just had a thought about having, through my years of being principal, when you said students under the age of 5 are not required to wear face coverings. Okay, kindergartners are generally 5. Once in a while you get a 4-year-old till October. So what, do they have to show their birth certificate?
No.
Okay.
No.
Okay, so how are you going to work that out?
Well, generally it's first grade and above.
Why would not be kindergarten?
Well, because
They're 5.
it's if you read it, it's age 5. We look at it as age 5 and below, or that don't have to wear it. So most of them are 5.
Okay, so students under the age of 5.
Right.
Okay.
Don't worry. We debated that for like a half hour in cabinet a couple times. So.
And is there any research about that being okay? Do you know?
I actually,
don't know if there's research.
I did ask that question to Will Humble of the Arizona Department of Health Association. I'm not sure if I said that association right, but I did ask that question, and he responded that it's probably okay if preschoolers and kindergartners, there doesn't seem to be a lot of spread among those young children. So that was one concern I had.
I apologize. I misread that.
That's what I did 5 times. Trust me.
Okay. Any other questions for the work study session? Seeing that there are none, then we will adjourn the work study and move to item 5, brief board meeting. And before I open that portion of it, is there a desire on the part of the board to take a brief break or move on?
Move on.
I'm seeing move on. Okay. So we'll move to item 5.01. Ms. Wilson, please call the roll again.
Ms. Laurie Wood,
Here.
Mr. Reed Carr,
Here?
Ms. Sheila Ujetti,
Here.
Ms. Jill Humphreys. Here. Dr. Charles Santa Cruz.
Here.
Mr. President, all board members are present. You have a quorum.
Thank you, Ms. Wilson. And with a reverse order in mind, item 5.01 is calling the meeting to order. And then we move to item 6, the consent agenda, and available for a motion.
I move that we approve the consent agenda as presented.
There is a motion. Is there a second?
I'll second.
It has been moved and seconded that we approve the consent agenda as presented. Any commentary, question at this point?
I just had one question, if we could just hear a little bit about the renovations for these 3 high schools and the security and the reasons for that.
The renovations, of course, will include, if you remember Mesquite High School, how we had some entryway securities that we refurbished over there. Looks really good. It's a good model. So moving forward, as per our plan, we have some thoughts and ideas and some plans for Highland High, Desert Ridge High, and Campo Verde High. And that's that's just continuing on with ensuring our campuses are safe and secure.
And eventually we'll do this to all of the high school campuses.
Yeah, we're
Okay, that's all I needed.
Any additional questions? Seeing that there are none, then we will vote on item 6, the consent agenda. All those in favor of approving consent agenda as presented, please signify by saying aye.
Aye.
Those opposed, the same. Motion carries 5-0. We move to item 7, and that is
Dr.
adjourning this
Stanek.
brief board meeting. Yes, Mr. Carr.
Before we adjourn, may I just take a small liberty?
Yes, please go ahead.
Earlier this evening, Mayor Jen Daniels tendered her resignation effective tonight. I just would like to extend my personal gratitude and perhaps the gratitude on behalf of the board for her service. She has been a strong supporter of our schools and has been a strong supporter of education in general, and just in my role as liaison to the board from the board to the town of Gilbert, would like to extend my gratitude on behalf of all of us to her.
Thank you, Mr. Carr, and I appreciate that you have taken the time to apprise us of that, and please extend our gratitude as well on behalf of the board to Mayor Daniels. Any other commentary, questions? Then with none, we will move for adjournment. Those in favor of adjournment, please signify by saying aye.
Aye.
Those opposed, the same. Motion carries 5-0. Thank you, board members. Thank you, those of you who have been observing this board meeting. And thank you to staff for your attendance and for community members who have been in attendance. We are adjourned.
Right.